All right, let's get right into it. We're going to talk about something that pretty much affects everyone sooner or later, but we tend to ignore it until we can't anymore. And that is how our vision changes after 60, and more importantly, what we can actually do about it.
Does that sound familiar? I mean, if you've ever found yourself blaming the dim lighting in a restaurant or using your phone's camera to zoom in on a label, yeah, you are in very, very good company. It's an almost universal part of getting older.
But here's the thing, and this is probably the most important point of this entire explainer. Just because these changes are common, it does not mean you're helpless. The best news is that you have way more control over protecting your sight than you probably think, especially if you get on it early.
So, to really get a handle on how to protect our sight, we first need to know what we're up against, right? Think of it like a roadmap. So let's lay out the 4 big conditions that tend to show up more often as we age.
Okay, so this chart is super helpful. It's like a cheat sheet for the big 4. We've got the condition, what's going on, when it usually shows up, and that one big warning sign to look out for. Let's dig into each of these, starting with the most common one.
All right, cataracts. In a nutshell, it's just your eye's own lens getting cloudy over time, like looking through a foggy window. That's why headlights at night can suddenly have those crazy starbursts around them, and colors might not seem as bright. It's not your glasses, it's the lens inside your eye.
Next up is glaucoma, and this one's a bit of a ninja. It's called the silent thief of sight for a reason. You literally don't feel a thing. It starts by sneaking away your peripheral vision, your side vision. That's why you can't just trust that you're seeing fine. Those regular eye pressure checks, yeah, they're absolutely non-negotiable for catching this one.
Okay, let's talk about AMD. This one zeroes in on your central vision, the sharp, detailed sight you need for reading a book or seeing a friend's face across the table. The camera sensor analogy is perfect. It's like the very center of the picture gets smudged or wavy, while everything around the edges looks totally normal. And it's not just one thing. AMD actually has 2 flavors. You've got dry AMD, which is way more common and kind of slow-moving. Then there's wet AMD. It's rarer, but man, it's aggressive because of these leaky blood vessels that cause damage fast. And figuring out which is a really big deal because it completely changes the game plan for treatment.
And last on our list is diabetic retinopathy. Now, if you have diabetes, this one is especially important. Basically, over time, high blood sugar can really mess with the delicate blood vessels in your retina. It's like your eyes are keeping a long-term journal of how well your blood sugar has been managed. All right, so that's the lay of the land, the what to watch for. But knowing isn't enough, right? Let's get into the what to do about it. This is the part where you take back control with some simple but incredibly powerful actions.
Look, we can't change our genes, but our daily habits, that's all us. And some of this stuff is, well, it's not rocket science, but it is so powerful. Quitting smoking is huge. Tossing on a pair of good sunglasses? Easy. Eating your greens? You bet. Every single one of these is a choice you can make today to stack the deck in your favor.
We've all been there, right? You leave the doctor's office, and 10 minutes later you think, oh, I should have asked about... Well, this is how you fix that. A little prep work is a total game changer. And seriously, that last question, if these were your eyes, that is a golden question. It cuts right through the clinical talk and gets you a real, honest answer. Okay, let's switch gears and talk about something nobody loves talking about, but we have to. The money side of things. Because let's be real, the financial stress can be just as scary as the health stuff, so let's get a handle on it. Yeah, a number like that can definitely make your jaw drop. But listen, the point isn't to scare you. The point is to show why getting a handle on your insurance coverage before you need it is so incredibly important. It's step 1 in not getting blindsided by a bill. So this chart breaks it down pretty clearly. You can see that basic stuff like standard cataract surgery is usually covered pretty well by something like Medicare. But see those premium lenses that correct for astigmatism or distance? That's usually on you. And those injections for wet AMD? Oof, that can be a real mixed bag depending on your specific plan. So here's your homework. Don't just ask, am I covered? You've got to get specific. These 3 questions right here, they are your best friends. Ask them. Write down the answers. This is how you avoid those nightmare surprise bills down the road. Okay, last section, and this one is absolutely critical. Most of the stuff we've talked about happens slowly, over years, but there are a few things that are the total opposite. These are the red alerts, the do not wait moments.
So what's just a normal change and what's a true five-alarm fire? It really comes down to one word: sudden. If a vision change happens out of the blue, the timeline for getting help shrinks from weeks or months down to hours, and that can make all the difference in the world.
I want you to burn these into your memory. Any sudden loss of vision, a weird dark curtain coming down over your sight, a brand new blizzard of floaters and light flashes, or just intense, severe eye pain. Any of those, it's an emergency. Full stop. Don't wait for Monday morning. Go get seen right away. And this quote, it just hits home, doesn't it? It's from a guy who actually waited 3 days, because it was a weekend and he didn't want to be a bother. A bother? We're talking about your eyesight. So this is your official permission slip to be annoying, to be pushy, to advocate for yourself. It's not just okay, it's your job. So when you boil it all down, what's the big idea here? It's that you are not just a passenger on this ride. You are in the driver's seat when it comes to your eye health. You have agency. So the real question is, what are you going to do with it? Your eyes have done a lot for you. What's one thing you can do for them starting today?